something regarding medical humanities. So today I didn't want to continue with a new topic, that is clinical reasoning. I wanted to consolidate so far what we've treated, so that when we move on, you will not be left behind. Okay. All right. So far I've been able to explain what medical humanities is about. I try to come from an angle that in naturopathic treatment, we talk about being a holistic approach to healthcare, which handles the mental and emotional aspect of the body, aside the physical, the spiritual, and the social aspects. It also handles the mental or the emotional aspect of the body, of the person. Okay. So under medical humanities, we are going to dissect further into what goes into the emotional or the mental part of that person as we render holistic medicine to the person. Okay, so that's what brought about the medical humanities. Okay. So, and I said that under this broad topic, we'll be treating introduction to psychology. We'll be handling clinical reasoning and critical thinking. Also be looking at social context and health disparities. And then also be handling humanism in health and healthcare. Okay. Yes. So I try to explain what humanity is about. Humanities makes you feel for the patient you are handling. It makes you put yourself in the shoes of the patient who comes to your facility. All right. So as a medical practitioner, you are practicing in your facility and somebody comes to you. As we take you through this course, and if somebody is in pain or somebody appears to not to appreciate what you are doing, you should understand that this is about humanities. Okay. I also said that medical humanities humanizes medicine. Okay, it makes you feel very compassionate. You become a patient-centered care person. Okay, you respect and you dignify the patient you are treating. You don't yell, you don't shout, you don't treat the person as if he's a nuisance to you. Okay, that is why we are treating this aspect of the course. Okay, where even when children or people who are behaving a certain way, you also try to behave in that way so that you can get their attention. Okay, right. So basically, you empathize with the patients. You also feel, in fact, when somebody cannot walk well, you hold the person, you support the person to walk well. Okay, so that also means that if you have a facility and you don't have a wheelchair there, please get one. Because some of the people, when they bring them there, they may have to be wheeled in a chair into your consulting room. And maybe when you do your magic, by the time the person will be leaving, the person will be able to walk. Okay. So we try to, and I try to also define certain terminologies, like when you say scientific study, what do we mean? Okay, where it involves you doing a very critical observation. You also experiment. You do experiments. You do investigation. You also do analysis of whatever you are saying before you establish your diagnosis. Okay. So, in naturopathy, you don't diagnose by saying that you feel like the person had malaria, that's why you give this medicine. If you don't establish the diagnosis, please establish it. If somebody comes to your facility and the person is vomiting, headache, joint pains, and dizziness, Don't quickly think it is malaria, especially those of us in this part of the world, Ghana and Africa. Somebody have headache and feverishness, we think it is malaria. It is not always the case. That is why you are studying this course, to know the type of test you have to request. The result will be presented to you, and then based on that, you establish the diagnosis. Okay, you're also doing medical terminologies. Okay, learn the terminologies very well, so that when you are writing your diagnosis, you don't go and write long statements. That is why you are learning terminologies to paraphrase your diagnosis for anybody at all to understand. We also treated what is about the mind. Okay, now psychology is basically the study of the mind and behavior. Okay, and it is the mind that controls the whole body. Though the mind and the brain are used interchangeably, but as I said, there's a thin line between the brain and the mind. You compare the two with what is as we have with a computer. The monitor, the CPU, and the keyboard is considered to be the brain, and then the software you are using to run the computer is considered to be the mind. So without the brain, the mind is not there, and then without the brain can also be there, but the brain has to work. So the workings of the brain is what is called the mind. Okay, so the mind is considered to be your inner world of thought, feelings, consciousness, and awareness. Okay, so we also look at the human behavior. Okay, where we handle what is meant by what is behavior. It's a mixture of our needs, emotions, learned habits, driven by both internal and external forces or factors. Okay, so behavior basically means the way we act or we do our things. Okay, and these affects the way we handle people. Okay, so that is what brought us into psychology. And then I made you people aware how the mind also works. Okay, so to summarize the whole thing, I made you guys understand that the mind controls the whole body. I think the last time we met, I came out with this controversial statement or question, and then one or two of you people tried to give us a different opinion. In fact, you were not wrong. Okay, in fact, if you read most of the books, it doesn't try to keep the brain as the most important. No. In fact, all the other organs are also very important. Okay, but the brain is considered to be the control center. Okay, because even if the brain is controlling, the brain needs supply of oxygen and certain nutrients for it to function well. So the heart will have to pump these nutrients and these elements to the brains. So even though the brain is the commanding center, if the heart doesn't pump the blood, and the cardiovascular system will also carry it into the brain, you'll be there and then you just collapse. So the reason why some people collapse, apart from other disease, it could be because the brain is lacking the needed oxygen or the nutrients, the glucose, for it to stay alert. Okay, so there's nothing like an important organ of the body. All the organs, the brain, the heart, the kidneys, the liver, the lungs, they're all working together to make sure we are living well. Okay, but the brain is considered to be the commanding center, but that is not the most important organ of the body. Yes, I can see Mercy Amoakon, your hand is up. Mercy, unmute your microphone, Mercy. Oh, she has just, dropped. Okay. All right. So, So the mind, as I said, controls the whole system. So if your mind or the brain is not working well, there are certain conditions that you could be affected with. Okay. And there are certain conditions, we call it the mind body medicine or therapy. Mind body therapy. And the assignment I gave actually falls underneath it. Okay. So under the mind or the brains is the central nervous system that also controls most of the activities of the body. Okay. And then from there, we went into our behaviors. And then I think I ended it there. So let me go into the assignment and let's see how those of you who are able to read it, how you want to explain it for us to understand. Okay. So the question was, discuss therapies that are controlled or influenced by the mind, and then explore how one of these therapies work to achieve optimal health. Please, who want to try, who want to share what you did? In fact, you can read from what you have done. There's nothing wrong because you did it, so you can read from it. Or if it's in your head and you want to say something, yeah, Philip Neme, you want to try?
Yes, please, Doc.
Okay, so which of them are you answering?
I'm answering the first one. That is the therapist controlled or influenced by the mind.
Okay.
And so, in my search, I came to discover that first of all, the human mind plays a critical role in health, healing, and disease prevention. So even in the contemporary biomedical research and traditional healing system, it has been found that increasingly recognize that thoughts, emotions, beliefs, and attitude significantly influence physiological functioning. So the therapies are controlled or influenced by the mind. And this is what you normally refer to as the mind-body therapies. So the first therapy that I look at is meditation therapy. And under meditation therapy, I found out that meditation is a structured mental practice that involves focus, attention, mindfulness, or contemplation. And it is widely used to reduce stress, anxiety, and emotional disturbances while improving mental clarity and psychological well-being. So there's a scientific evidence by research conducted by Goya and others in 2014. They said that scientific evidence shows that meditation practices lower stress hormones and also reduces symptoms of anxiety and depression.
Okay,
And
Philip.
Doc,
Yes. So in order not to cut you short because of time, did you come across how the meditation is done to
yes,
achieve
please.
this therapy? Okay, so can you take us there how the meditation is done? Okay.
All right, sir. Okay, so I'm now taking you through the meditation therapy. So the meditation therapy is, as a concept and a principle, is founded on the principle that calm, focus, and disciplined mind, which promote physiological balance and enhances the body natural healing mechanisms. So the first one is what you in under meditation mechanism is the stress reduction. Hello, Doc. Please, can you hear me?
Yes.
All right. So under it, we have stress reduction. So first of all, chronic stress, as you know, triggers sustained activation of the sympathetic nervous systems, which elevates cortisol secretion, which contribute to inflammation and immune suppression and disease development. So under meditation, It activates the parasympathetic nervous system by promoting relaxation and significantly reducing stress hormones levels. So on the meditation mechanism, the first point that I look at is stress reduction. The second one is also about nervous system regulation. And on the nervous system
Okay,
regulation,
Philip.
dog,
Philip.
dog,
Yeah, you are trying to explain to us what the meditation does. Okay, but I want you to. I don't know whether in your reading you read on what involves in the meditation. I mean, what do you do in the meditation? Do you isolate yourself in a quiet place? Do
And
you sit?
dog,
That is yes.
Dr. Please, I have similar thing. My own is mindfulness.
Okay, so I'm coming. I'll come to you. So Philip, did in your search did they tell you that the steps that goes on in the meditation therapy, or you didn't tackle on that one?
no place. I didn't look at it.
Okay, then let me go to Vivian and let her add it to it. Okay, thank you, Philip.
Thank you, dog.
Thank you.
Okay, so dog, please, my own. I chose mindfulness. And when we talk about mindfulness, is the way we see things clearly or paying attention on whatever is happening around us. And being practiced, the mindfulness, it benefit the heart, the head, and the body. It also helps to cultivate clarity and understanding and step away habits that one has, which always do being negative way or positive way. And how to practice mindfulness. Okay, let me go with the benefits. As he said,
No. With the benefits,
okay,
just tell us what do you do in the mindfulness? What kind of activity do you do?
okay,
Did you
dog,
read on
please
that?
with the yes. You will find a quiet place, or you can even do it on your bed. You will sit either on your bed or a chair. And if you want to practice mindfulness, you have to do it around, let me say, midnight, because when you do it during the day, you won't focus because you will hear noise. Maybe where you are, you could maybe hear car passing, or you have children, they will disturb you. So you can choose to do it. The correct time to do it around 12 to 2 a.m. or even 4 a.m. You can do it. So how to practice mindfulness? You have to sit on a mat or a chair, even on your bed. You put your hand on your laps, then you will notice that your leg is moving. So with this, you will sit quietly and you will straighten up your body without stiffening. So you will notice your arm also is shaking. And please let me open my book.
Okay.
Okay. So you notice what your arm is doing. And also you can drop yes, so you have to hold your breath, like you
Your
will
breath.
sit
Okay.
quietly, your breath. You will sit quietly and notice that what is going on. You can feel that your body is moving, being your stomach. So it will start from, you can start it from your head to your lower body. That's what I got.
That's what you got, right?
Yes, please.
Okay. So maybe next time I'll suggest you can also go to YouTube, okay, and then
Okay.
you watch videos of somebody trying to explain it so that you see it well, and then maybe in your explanation you can also come and tell us well, okay.
Okay.
So then because of this, I'll give you that assignment. Go and search it
Okay.
further, and then you
Okay.
and Philip Neme, okay, the meditation and mindful, they are all under the same stuff, okay. What do you do under that material moment? Okay, so let me give you a typical example of guided imagery, okay, which is also under the mind body therapy. So well, I don't want to take the wind out of the sail. Maybe it's somebody's work, so let me not. Great. So thank you, Vivian, and thank you, Philip. Okay, normally, okay, so the benefit, Vivian, you wanted to say something about the benefits. Go ahead.
Yes, please. It reduces anxiety and stress, and also it's better our memory.
Okay,
And
so Vivian, let me. I'm a student and I'm a teacher who believes in details. Okay, I will put you on the spot. If you can't answer, don't worry. Okay, you go, and that will make you, next time when you are doing your research, you do it well. When you say it reduces anxiety, what do you mean by anxiety? Can you give me an example of somebody who is going through anxiety moments?
Yes, dog. When someone is overstressed and the burden the person is carrying is over the person, and please, I will go and come back.
Okay, so or Philip, you want to help your partner in this area. Anxiety. When you say anxiety, what do we mean? Philip, are you there? Okay.
Yeah,
Then,
dog, I'm there.
would you want to come in to explain to her what is anxiety?
Okay.
Or should I go and come?
Oh no, let me say a little on anxiety.
Sometimes, as I said, when you ask a question, you can give an example of a situation to explain a condition. Okay, because maybe how to express yourself is not coming. You can give us, okay, when a person is this and that in that,
Yes,
and the
yes, yes.
person is exhibit this thing, it means that the person is going through this. You can sometimes use that to explain yourself. Okay.
Oh, okay.
Right.
So
So
anxiety, as my sister started, you look at somebody who is under tension. Like as you used, for example, the case study you give us, Mr. Sedu, case study.
okay.
Hello, Doc, can you hear me?
I'm listening,
Yes.
please.
So if you consider Mr. Asiedu situation, as he working on that kind of working condition, Mr. Asiedu can be described as somebody who is experiencing anxiety because where he is working, things are not going on well. If you continue to stay in this environment, one or the other, it might affect his health condition. So when you are working at when you are at a place that, as my sister started, when you are under tension, when things are too much on you, you become how do you call it, depressed and anxiety.
Okay, thank you. So let me go to Dr. Ban.
Yes, sir.
Uh-huh.
Okay. So please, I wanted to answer or help us with the anxiety.
Okay,
Like it's
anxiety, great.
maybe a practical session. Okay, so for someone like me who work in a fertility clinic, sometimes when these women come, they exhibit this sign of anxiety. They are restless. They are shaky. They will tell you, "I cannot sleep well," and they show excessive worry. They are worried that they are not getting pregnant.
So the word
So
I'm looking for is excessive worry. Okay. For instance, the typical example, let's say you are going to write your exam tomorrow, and the school says that those who are owing fees, you cannot write the exams. You don't know where to get the money from. Definitely, you'll be worrying. Okay, definitely, you'll be worrying. And you'll be showing signs of worry. I can tell you, either you are very quiet, or anybody you meet, you want to talk to for help, or you'll be calling people, and even the words you are using in your conversation shows that there's some level of excessive worry. Such a person, the way he's behaving, he's going through an anxiety moment. Okay, great. Thank you, Dr. Ba. That is the word I was using, excessive worry. Yes, Dr. Henry Kwe, your hand is up.
Thank you, Dr. Ross.
Mhm.
Yeah, anytime we talk about anxiety, we are talking about being anxious about something. Like you said, excessive worry. Yes, being tense about. Yesterday, for instance, I was home in the evening when my wife gave me a call. She's not around currently. She's doing the program. She's a PA, but she's doing uh, public health master's somewhere. So my boy is also in school, final year, and called that he has fallen down. He's falling down, and then he said, "Oh, you should go and then go to the infirmary at school so that they take care of." This morning I was at church when I had a call. The call came first from the school. Then later my wife called. That is say when he went to the infirmary, he was giving a kit for X-ray. The nurse said you should go and do X-ray, meaning that the thing has become serious. In this case, I wanted to even stay at church close before going, but the way the call came, I had to stop everything and then get to the school to find out what's really happening, and then send the boy to the medical lab. I'm saying whatever, for to go and do the X-ray. We are done with it. Now we're waiting for the report to be given, even though the image has been given. But around this time, within this period, whether there's kind of tension, what is happening? What has really happened to him? He's in his final year. He's going to write exam. Not this time that such a thing should happen. One is going to, apart from the money that may be involved in it, they are also writing their mock. Will this boy have the ability to do it? So at this time, there's that kind of tension, worry, and sometimes the worry becomes excessive. When it comes excessive, that's where we talk about it, anxiety. Talk about because there's some kind of tension.
Good.
Yes.
So you see the approach Dr. Kwe has used. He used an example to explain. So you see, even though he will not define what anxiety is, he will tell you that going through such experience, you are considered to be very anxious or going through anxiety moments. Okay, so this is a very fun time. In fact, if I ask such a question, and this example came from Dr. Kwe, and I'm to give him over 5, I'll give him 5 over 5. Because so this is a typical way to explain something. If you don't know how to define it, you give an example. Okay, so a woman travels to the market to go and buy things, and then after buying the things, coming back home, there's no means of transport, and she has left the children at home. There's nobody taking care of the children, and it's getting late. She doesn't know where the next car will be coming from, and though she's standing by the roadside, definitely such a human being will be showing excessive worry. So she's going through, she's very anxious and going through anxiety moment. Okay, yes, Dr. Okran, your hand is up.
Okay, Dr. Rosa, can I go for the next therapeutic approach?
Yeah.
Okay, I'm looking at cognitive behavioral therapy, CBT.
Cognitive behavioral therapy.
Yeah.
Okay.
CBT. And it says that CBT is psychotherapeutic approach that addresses dysfunctional emotions and behavioral thoughts through goal-oriented systematic procedures. So it helps individuals reframe negative thoughts pattern, leading to improvement in mental and physical well-being. This one, I have a personal experience back then in 2003. I met a white lady, Jennifer, online, and then she was just bombarding me with insults. So I took my time patiently. I asked her name, she insulted me. I asked the location, she insulted me. So I just jumped in and said, okay, anyway, I'm Isaac. I'm chatting from Africa. Then all of a sudden, it captivated her attention. Wow, Africa! That's far away. And I said, yes, that's far. How is the place? Now, I began to engage her. How is the place like? How is it? Then all the insult just vanished. So after I saw her that she has calmed down, I asked her that, it seems that you are such a wonderful person. You are a nice person. But the initial approach towards me, I don't seem to condemn you. I think something might be worrying you. Can you share that problem? Then she remained silent for a while. And then she said that, yes, I had a problem. Sorry for my behavior initially. I had a boyfriend who has been with me for 5 years, and all of a sudden he decided that he wants to go and marry his girlfriend in the university. So I got broken. I'm depressed. I can't do anything. I can't eat. I always contemplate of committing suicide. I said, no. And I said, before you met the guy, were you a happy person? I said, oh yeah, I was a happy person. I have a wonderful family, yes. And I told her that, Jenny, you know what? In life, we have circumstances. Circumstances should not define our personality. Circumstances comes and it goes. And most often the time, some circumstances that we will consider that is so precious to us, maybe in the eyes of God, that circumstance will rather destroy us in the future. So sometimes nature and God find a way to clear certain situations out of our life. And when it reached that point in time, sometimes being human, we become very emotional. And at the end of the day, it affects the way we behave. And in the nutshell, it will rather destroy our life. So it was a circumstance. Yes, maybe you have had a good times together, but consider the situation as it never existed. It's an experiential moment of life. Take the other aspect of it and relearn, so that next time you see life in a different direction altogether. Get hooked back to the family. Enjoy the wonderful family life you have gotten. The enjoyment, the happiness, the excitement you once had with your family, and get back on your feet. So she says also, wow. So I said, are you a pastor? I said, no, I'm not a pastor. I'm just a Christian.
Yeah.
And from there, she began to speak nice and such. For the first time, for the past about 2 months, I'm relieved. In fact, her junior sister even tried to, she got my Yahoo number account and contacted me. Said, what did you do to my sister? Because for some time, she doesn't eat, she doesn't speak to anybody, she become gloomy. She is always on the internet. So this is how the cognitive behavioral therapy, I think, to my understanding, that is how it works. How we could approach people, be in their shoe, and try to help them come out of the negative emotion and to become reformed.
Okay.
Thank you.
So with this exercise, if the person is going through persistent headache, the headache will just go. If the person is going through sleeplessness, the sleeplessness will just leave her. If the
Yes,
sleeplessness
because
has raised up the blood pressure, the blood pressure will
yes,
become normal.
sure.
Okay, great. So thank you, Dr. Okran,
Thank you,
for
sir.
such an amazing example. So this is some of the example I'm expecting in your approach to answer. If you just tell me that maybe guided imagery is this and that, and just end there, fine. That one everybody will read it, but we want experiential expose about what you mean by that therapy. Okay, so let's go to Gerald Okran. Your hand is up.
Okay, so I would like to speak on hypnotherapy.
Hypnotherapy.
Yes, please.
Yeah, today I watched a video on hypnotherapy. So please, I hope you are not going to define to me. You are going to give me a typical example.
Yes, sir.
All right,
From
go
my
ahead.
knowledge, I'll give an example that I best involve. So before I touch into hypnotherapy, I just want to talk about the mind a little. That the mind is a gateway to a perfect state of a body, in a sense that when your mind is stationed or signaled in the right direction, then your body what becomes at ease. There are certain religions or state of beliefs that see the mind as the key to the entire body. Some of the religions are like Buddhism, Ayurveda, and all these like kind of Asian um, beliefs and stuff like that. So now jumping into hypnotherapy. I want to say hypnotherapy is when or the guided relaxation and intense concentration are achieved when your states are heightened. That allows the mind to reframe the way the body perceives pain and phobia. I hope you understood my definition. Okay, so now let me give an example. I know we've experienced this. Whenever a baby falls down and he gets hit,
Whenever a
normally
baby,
a baby falls down and he
okay,
gets hit, normally the baby will cry. But then if you're the baby and you're laughing with the child, he will start laughing, forgetting the pain. So this is a form of what hypnosis. That you have psyched the mind away from the pain, away from the phobia, because the baby will stop crying and start laughing with you. I hope you are
okay.
getting me.
So this is a
So
typical example of
that's
hypnotherapy.
yes, another form of hypnotherapy.
So in a nutshell,
And you have relaxed.
you say that hypnotherapy is trying to move the mind away from the source of pain,
Yes,
the source of worry, by
yes.
exposing it to something that brings excitement and happiness, right?
Excitement and relaxation. Yes, please.
Okay, okay, good. So these are some of the ways I would wish that when we're explaining some of these things, you do. And please, it may come in the exams, I can tell you. So go and read about examples, some of the examples that you can use to explain yourself. Okay. I don't want you to come and define it to me. No, 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 no. In fact, this course is a vocational course. It's a career-oriented course. So we don't want to come and tell me that, let's say, guided imagery is you put somebody there, you there. No, no, no. Fine. Then you give an example. So, for instance, guided imagery. Okay, somebody is going to have, let's say, breast cancer surgery. Okay, and then the person is very anxious. The person is depressed, doesn't know what to do. Now, guided imagery will begin to put the person in this state. You put the person down, seated or lying down in a very quiet environment, and then you ask the person to begin to imagine nice moment he or she ever had in life. So let's say that this person once went with a husband to a very nice hotel by the poolside and they were relaxed. So this lady started picturing those nice moments where the husband was discussing with her the future plans, how they are going to build real estate. They are going to real estate. They are going to build houses to rent. And then they are also going to build executive offices for people to rent. And the monies that will be coming, the husband tell her, I will get you this car. You ride in your old age. Our children will be in these universities. And every Christmas we'll be traveling. So the woman start to imagine those moments again. Okay. And then tell the woman that as for the surgery, it's just a transitional something. After the surgery, your husband will be by you, going to enjoy those life again. So that is about guided imagery. Okay. You let the person begin to imagine wonderful moments in life. And then let the person know that, look, this is also about life. So the surgery you are going through, a lot of people have gone through it and they are doing well. Okay. Yeah. So by the time the person come back to the consciousness, though the person will still go through the surgery, the imagery the person has formed in her subconsciousness will begin to shaping some physiological pathway in the body, and then she will go into the procedure boldly and with all comfort, without any depression. Okay. So this is about guided imagery. Yeah, so let us move on now about the mind-body therapy. Let us jump. Let us go to the other one because time is close, so that we're exhausted. Let me look at the other question. All right, so let's look at Mr. Siedu's issue. Mr. Siedu is working under a strict, inconsiderate, unfriendly, and callous manager in his place of work. Discuss how such a toxic environment can impact on the health of Mr. Siedu. And as a naturopath, explore practical ways to help Mr. Siedu contain this situation and live a healthy life. Now, I'm going to mention names. I don't want the same people to come and explain to me again. No. Let me I have some lovely people around. I want Lady Zuzu. I want to hear your voice. You want to tell me something, Lady Zuzu? Is Lady Zuzu in class? Hello?
Yes, sir, please. Yes, sir, please, I'm here.
Yes. Are you aware you have a very nice voice, Lady Zuzu? Are you aware?
No, sir.
Oh, so nobody has told you that you have a very nice voice. Nobody has told you?
Not really.
And then it's one of the mind-body therapy I'm giving you. Okay.
I've told her before. Yes,
yeah. So, Lady Zuzu, were you able to work on this assignment, Mr. Sedu's issue? Were you able to work on it?
Yes, sir, I was able to.
Okay. So, would you want to tell me what you were able to work on it? And as I keep on saying, please, no answer is wrong. Okay. Let us share our views on what we work on. Maybe you might think what you did is correct. You bring it out, and then we can fine-tune it, and it becomes a whole therapy for somebody. Okay, so please let's share our work with each other. Yes, Lady Zuzu. So what did you come up with, Mr. Siedu's working environment, Lady Zuzu?
Thank you very much,
Good.
sir. Well, so we were asked to help Mr. Siedu to contain his situation.
Okay.
And I think what
Should
I
I go
can
and
do
come?
to...
Should I go and come?
Yes, sir, please do.
Okay, all right.
Please.
And I like a very honest person. I mean, she's trying,
Thank
but
you.
she says you go and come. Yes, okay. So now I'll not call anybody who want to share with us what he did for Mr. Siedu. Now, this Mr. Siedu can be one of your patients. So if you're able to work on this, maybe you'll be able to help Mr. Siedu to handle this situation. Who was able to work on Mr. Siedu's situation? Okay, let me call another person.
can I try something?
Yes, Ambro, Dr. Positive, right?
Positive. Yes, please. I want to say something.
Okay, can you raise your voice a little bit, please?
All right, sir. Is it okay, please?
Yes.
Okay, so there's a little I was able to gather, and I would like to share with us. When it gets to Mr. Siedu's, let me say, situation or issue, there are certain things that, let me say, got into my mind whilst I was trying to understand the whole thing. So I read a little, and then I want to share, even though there are many, but I just want to make it short, like summarize it.
Make it brief, yes, please.
If not, the whole time will just escalate. So the impact of toxic environment on health, which is the general.
So maybe your approach, you may try to explain what the toxic environment is. Okay. Sometimes. Because if
Yes,
I set a
okay.
question, let's say with Mr. Sedu's issue, definitely as part of the marking scheme, I'll be expecting you to explain what a toxic environment is. Okay. Go ahead.
Okay. So we are looking at an environment where a person's state of mind is not too stable or comfortable in terms of working. Either too much pressure or, let me say, unfriendly acts at work or environment that the person lives in. It can be at work, it can be in the house, whether the family, church activities, or whatever. But now we are looking at the workplace. So with Mr. Siedu has having a manager or a leader or a boss who is very unfriendly, this can really trigger what we call the chronic stress response in the mind. Um, and in this case, when that happens, let me give this scenario. Once upon a time, I was working in a different hospital. It was a clinic right then, and whatever you would do, the manager or the boss in charge by then will not be happy. He wants you to do things in his way, yet we don't know what is in his mind. He expects you to read what is in his mind. When you read him that, okay, this day, this time he's going to do this, he will do a different thing. And he expects you to do what he was thinking. And it was so unfriendly that in a way I have to find my way, because I can't work with you more or less if you don't trust me. If you don't trust me, we can't work together. So therefore, you expect me to read what is in your mind when you've not told me. Likewise, I can also read your mind when we've not equally said anything to each other. So when it happens like that, I looked at, there's one thing I looked at that I want us to share, which is the cardiovascular system.
You have just about 3 minutes to wrap up.
Okay. So now the cardiovascular system, the chronic elevation of cortisol and adrenaline increases heart rate and blood pressure over time. This leads to hypertension and an increased risk of stroke and myocardial infraction. Yes. So with this one, when the mind is not stable, the last time we were teaching, you told us about the mind, how the mind regulates the heart, whatever the heart goes through, or the work that the heart does, automatically is from the mind. So if the mind is not stable, if the mind is not at peace, the heart will be troubled. So therefore, you need an environment where you relax, not necessarily having a complete relax at work. Sometimes when there's no supervision, proper supervision, you can also go off to do the things that you think that are right, but may not even go in line with work. So you need to be supervised. But when it's overdone or when the person overdo it, it distorts your whole mind and affects your heart in a way that you may even do things wrongly. And before you realize, your pressure is rising to the unexpected level, which can lead you to death. Maybe one day you'll be at work, you just put your head on the desk. Before you, they say, Jack, you are gone. Because the mind, the heart has overpumped so much in the brain that the brain cannot contain it. So maybe the body system will have to shut a portion down or the whole body down.
Wow.
Thank you.
Yes. So you see the example Dr. Positive has given. If I'm to mark him over 5, I'll give him 5/5. Okay. We are, you see, the course we are doing is a vocational course. We are saving lives, so we want examples. So the example Gerard Okran also gave about hypnotherapy is an amazing one, just a crazy one. I mean, an awesome one. And that one too, if I'm to mark him over 5, I'll give him 5/5. So maybe for the first time, I'm going to hear this lady speak. The British lady, apart from Lady Zuzu in class, Vera Osai, are you there? Vera? Hello, Vera.
Yes, please, I'm here.
Good. People want to hear your voice. You've been hiding so much. Yeah, so we'll also give you just about 3-4 minutes to speak, okay?
Yeah, so about the situation, I would
Mr.
say
Siedu,
that,
right? Okay.
yes, please. I would say that when we talk about toxic environment, it's basically a place where there is where the negative energy outweighs the goods or the positive energy. Now,
So, Vera, wait. When you say negative energy, you may have to explain it to negative
yes,
energy. What do we mean by negative energy?
yeah.
Or
So,
even positive energy? Okay.
yeah, so as regard to what he's going through at his workplace, or let's say negative, I mean negative behavior, that is specifically. Now, as regard to what his Mr. Siedu goes is going on in his is going through in his workplace, is I could say it's as a result of negative behavior or negative energy. Now, which damages the person's mental health. Now, as a result of this, okay, I in my place would want to use yoga, which is the yoga and meditation, okay. And I would say that when the body and mind is out of balance, there is always a warning sign. Now, with the warning sign, we have the physical sign and the mental or the emotional sign. Now, I earlier on I had wanted to talk, but then concerning the I had wanted to talk a bit about yoga and meditation, and so I would want to use this. Would do both the practical aspects of it with Mr. Siedu's case. Now, in many times with the little encounter I've actually had with yoga, it's been tested that a couple of which I haven't done deep research into it, but then there are a couple of evidence that people come with saying that yoga really help them release stress. Aside the stress level, it also help control their temper, okay, that's their temperament and all. So as a result of this, I would say that if the body and mind is out of balance, there is always a warning sign, and which is both the physical and the mental way. Now, with the mental way, I'll talk about the stress and anxiety, the poor concentration, always as a result of when the body and mind is not balanced or is out of balance. Now, when I talk about the physical signs, that is when we talk about the frequent headaches, the aches, the body aches, the wrong postures, and all that. Now, if a person is able to go through a good meditation, okay, staying focused, and as you made an example of a good environment, remembering some good things that has happened in his or her life, that could be a healing factor for that person, and is always going to help the person overcome certain things anytime there is situations. Okay, so as a result of that, Mr. Siedu could, if I would say that if Mr. Siedu is engaging himself with exercise, yoga exercise and meditation, this could be a place for him to be able to stand in, to be able to help him heal from such situation and overcome things out of the negative behavior, energy.
Okay, so Vera, would you also advise Mr. Siedu to quit?
No, I won't. I won't, because it has to do with the human. I wouldn't advise Mr. Siedu to quit. It has to do with the human behavior.
Mr. Siedu
Okay.
has been there for 3 years, 4 years, and this situation is escalating. A high pressure, persistent headache.
Yeah.
Because of
So
that,
what
he's on medication.
Yes. So it's just because Mr. Siedu hasn't had the encounter to have yoga exercise, both the meditation and then the some yoga poses that could be of help to him to release some stress and help him manage certain things. So he's obviously going to see those things coming, but the time is going to come that he's not going to experience all those things anymore. Why? Because as consistent practice, okay, Mr. Siedu will be able to overcome it. Because if Mr. Siedu leaves that working environment and moves to a different working environment, trust me, Mr. Siedu is going to experience another thing. Is he going to leave that workplace? That is another thing. So we always look for means and ways to solve issues, but not to run away from the issues. And that is why we have yoga and meditation for you. That is why there is relaxation exercises. That is why there are things to do to help psych your mind, calm you down, relax your nerves, and push you to the next stage of life. Because
Wow.
if yoga can help you release some stress, hormones like can help you release stress and keep you fit and activated, then why don't you start with it? Because you can't just give up
Okay.
out of it.
Great.
Yes.
I think this topic we may have to continue. Okay. Time is not outside. Let me go back to Lady Zuzu, a wonderful lady I want to always listen to. Yeah, Lady Zuzu, you want to come back?
Yes, I wanted to, but Madam Vera has said so much.
No, so you tell us what you wanted to say. Tell us.
Wow.
So, Mr. Siedu is working under a very toxic environment. And I'm assuming this toxic environment, probably the manager is always insulting him or shouting on him, disrespecting him or something like that. And this can also put a lot of load on him, make him very worried also and stuff like that. So I'm thinking that the solution to this can be probably if he can set some boundaries at work, probably how he relates to the manager. And I would also advise he practice some stress management, something like deep breathing, meditation, yoga, just as Vera said, and probably eat well and try to sleep good as well. Is also going to help him.
You can't sleep. You can't sleep good under this condition. Lady Zuzu, you can't sleep. So let me give a typical example of what you went through during our graduation.
Yeah.
Okay. You see the investment you put up there,
Mm-hmm.
and then people didn't even recognize that the structure you put in there was money. And you did that because you wanted the returns. And those freelance photographers, they were rather bringing people to come and take it. And some of the students also didn't know. I don't know whether they thought it was the university that put up that background. They didn't know it was somebody's business strategy to get some income or returns. I could see when I even wanted to take a picture with you, we have to even beg somebody to leave the background. The person didn't know that you were the owner. Okay, so I can tell you, you experienced some bad energy on that day, and I'm even yet to find out. Maybe I'll call you later to find out. And definitely there'll be some losses. Okay, how did you overcome it? How did you manage it? So this environment you experienced on that day, if let's say we are to hold another graduation, it will put you off. But as I told you the other time, in fact, the workers of that place were even telling us that they were surprised the owner of the background allowed people to do that. He said we could have resisted them from doing that. So going forward next time, as I told the other time, we are going to put in strict measures that the background you mounted, those who want to come there, you need to pay to come and use it. Okay,
yes,
so this is how you can also relieve the pain you went through. I know once in a while that bad experience will flash through your memory. Okay, but you are a human being, you need to move on in life. So maybe we may have to take you to Vera.
and I'm ready to welcome him.
Yes,
I'm so ready. I can't wait to hug him.
absolutely.
Please, recover
Can't
very
wait to
well.
have,
Okay.
yes, a relaxation activity like that would be great, and it will
Unfortunately,
help me
our
come
time
back.
is up. Please, are you meeting Madam Donette immediately
Yes,
at
sir.
8 o'clock?
Yes, sir. She's on standby.
Okay, then please, Dr. Ba, Dr. Henry Kwe, Madam Steffi Donette, Bishop Emmanuel Ba, Imadodu, please, our time is up. We don't have all the time to ourselves. So maybe next week, before we go into the clinical reasoning, we'll take the first 30 minutes to wrap up on this topic. Or if possible, we can continue, because this kind of therapy, people need it a lot. People need therapy, this kind of mind-body therapy a lot. They don't need any physical medicine. They don't need any machine. Just the vibes, the talking, exposing them to the way they think will just bring them the therapy they need. Okay. So please, Dr. Ba, I want the class attendance today. I think as of now we have 54. So please, I want to believe you've taken the picture, the snapshots.
Please,
Let me have
Charlotte,
it.
please do it for us.
Have you taken it already?
No, sir, I'm just about to do it.
Okay. So Bishop, I'm sorry, I can't take you because you'll be moving to the next class and the lecturer is on standby. Okay. Thank you. And then may God bless us all. Good night. And see you
Thank
next
you
time.
so much, sir.
Good
Thank
night.
you so much.
I want to leave you
Good night.
Good night. Good night, brothers.
all right.
Good night, Dr. Russell.
Good
Have a
night.
nice weekend.
Thank you very much.
Please don't leave. We'll be starting soon. Please don't leave. Thank you.
One boy and rain, sir.
Prophet
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 Albert,
Albert.
Prophet Dr. Albert, please, your mic.
And here is your.
Madam Zuzu.
Yes, sir. Dr. Charles.
Using the same link? Or
Yeah,
different
yes,
link?
sir.
Yeah.
We are using the same link.
Using the same link or different? All right.
Yes, sir.
The same link. The same link. The same link.
Good evening, class.
Fine evening.
Good evening.
Good evening, madam.
Wonderful. How are you all doing?
We are all doing well.
You are doing well. How are you?
Wonderful. I am great, thanks. It's been a great day. Thank you. Thanks for asking. Today I had prayer breakfast. My family fellowship with a group. There are 5 families of us, and we had a prayer breakfast this morning. So that was good. I came home, rested. My children are home. My children